Hello, this is Dr. Steele. Today I want to remind you about what I treat, which is diabetes, since 24 years ago. And I'm going to give you some pillars of what diabetes, how it needs to be treated. It's a complex subject because we have different ideas, different ways of doing things. But at the end, we need to figure out not to make things complex, but make things simple. Simple to the extent of what works. Because we cannot be fancy and talk about all the ideas why diabetes is the way it is, but how can I, control my diabetes? And I have spoken before. I always follow three things in my practice, and one of the things is using the letter P for prevention. Prevention is prolonging life. I know you and I that we're still gonna go. We're not eternal. One day more is one day less. But what if we can prolong our lives with quality of life for another week, another month, another 10 years or more, if we can help it? So, diabetes also, I use the word D for detecting early. And D for detecting early, I emphasize the word early as much as we can because certain conditions like cancer, they're very sometimes challenging to detect. Also, I use the letter C for control. Control and the word control because we want to figure out ways to delay the inevitable getting complications, of course, dying. So control as many factors that we know because we have done the research and we have followed people through time of the things that we know for a fact are going to be detrimental to our longevity. What is that we can control? In this case, which that's what I treat, just like me, I treat diabetes. And I want to make sure that your blood pressure, your cholesterol, your sugar levels, your vitamin D, your testosterone, your B12, the thyroid, all those factors that can modify how your diabetes gets controlled, get controlled. As well as we need to understand that we talk a lot about diet and exercise, but understand diet and exercise are very, extremely important, but that's not only the key. You can put in one pillar diet, which are that's the primary treatment. If we don't improve how we eat, if we eat a lot of fake food, not real food, we're gonna have issues, even though we take good medication. Exercise, we don't move 180 minutes per week at least, not only move to the way of walking by doing squats, doing push-ups against the wall, and of course, doing some aerobic exercise, our body is not going to do as good. But also, we need to understand that as we get older, things we run out of stuff. If we run out of stuff, we need to supplement them. And I like about diabetes now that we have beautiful or outstanding medications that can help us add to it to the things that we're not no longer producing, and we can supplement them. So now medicine is becoming more a supplementation way of doing things. Even though we still use medications, but the other medications that we take right now, they're supplementing things that we're not having anymore. For diabetes and for instance, thyroid, we still produce thyroid, but we still have to take supplements when people have thyroid dysfunction. And so we need to also use that. Even though we do diet and exercise, we still need to use that. It's like asking a person that is already bald to grow hair back by dieting and exercising. It doesn't work that way. We need to add to it, right? And I'm not saying you want to add to it, meaning that we need to supplement the body with things that we can use that we know are proven to make our body be more in something called in medicine homeostasis, more in balance. Another one, the fourth pillar will always be how you think. If we don't, if we always think that we're not going to be for a long time, it'll become our truth. Our mindset is very important. What can we do today, even myself, with or without diabetes, just like me? What can we do today to prolong life? And we need to do that every single day. And the issue here is consistency that we say we're going to do, but we don't. I'm going to try, but trying is lying. We don't follow through. So just do your exercise. You don't have to do a lot, just do some every single day. Eat as healthy as you can. Don't eat fake food, eat real food. We talked about that before. take your supplements, i.e., medications, i.e., means that is medications or supplements. And of course, think positive because I cannot be thinking about the end when I haven't gone, we haven't been through all the things we're going to go through. And we don't need to think that something's going to happen to us because something's always going to happen to us. Unfortunately, we all have an expiration date. So by saying that is that take that out of the equation. We're still going to have complications. We're still going to get sick. A lot of things are going to happen. But the question we need to ask ourselves, is it happening right now? And the answer, I think, for most of us is no. So live, as they say, as if this was your last day. And in my case, I have to learn and improve as if I was going to be, here forever. So always have that faith, that belief, that hope, because we're here for a few years, and we need to make it count. So what's my talk? That's my talk for today. Please take care of yourselves and remember, the greatest wealth is health. Talk to you soon.